I'm Sharissa. I'm a pharmacy technician student here. How can I help you today?
I got this blood glucose monitor a couple weeks ago, and I completely forget how to use it. Can you show me again?
Sure. So this is for your type 2 diabetes, I'm guessing? Okay.
Yes.
Okay, so it looks like we set you up with the One Touch VarioFlex. Okay, so this is the monitor here, and it looks like they set you up with everything and got it ready to go when you were in last.
Yes.
So this is the lancing device. So this is the device that's actually going to be used to poke your finger to draw the blood. So in order to open it up, we'll have this One Touch symbol here facing yourself. And if you just take the cap and twist it away from you, just so the lid's at an angle, and then you can take the cap right off. And then we will put in one of these lancets. So it looks like this. You can hold onto the circular end and stick the other end into the blue piece of the device here until it clicks into place there. And then to expose the needle, we're just going to grab this circle end and just twist and pull it off, so you can see that the needle's exposed there. We'll save this for later, and then we're going to put the cap back on just at the same angle that you took it off and twist it back into place. So you can grab this middle lever here and pull it back just so that you know that it is engaged and ready to go. The dial on the end here, this is the depth that the needle will go into your finger. So we recommend starting at 4, and if you notice that it's not deep enough and not enough blood is coming out, you can just turn it so that it's a higher number, or if too much, you can go the other way. And then now that we have that ready, we will take one of these test strips, and we will have the gold side facing towards you, and just put the end with the prongs inside the top piece here. And you'll notice that a droplet shows up on there. That means that it's ready to go. So after you get that ready, now we can actually go ahead and poke our finger. So we recommend doing the side of your finger, not really the pad. So if you stick the end with the little circle here just to your finger, and when you're ready, you can push the white button, and that will eject the needle into your skin, and we'll be able to get a blood sample from there. And then once you have the blood sample, if you don't get enough blood, you can massage your finger a little bit and warm it up. You can just touch the blood sample to this little line. It's a channel here that collects your blood until it fully goes red. And then the machine will start counting down from 5, and then it will give you your blood glucose reading. So the colors on here kind of indicate the levels that you should be at. Did your doctor kind of tell you what levels he wants you to be at?
Yeah, he did.
Okay, so green, you're good. Blue, your levels are slightly low, and red, your levels are high. And it's a good idea to maybe log your results just so you can kind of keep track of what your results have been throughout the day, so you can take those back to your family doctor. After you get your blood sample, you can just take the test strip out. You can wrap it in a tissue if you want. Did you get given a Sharps container last time you were in?
Yeah.
Okay, perfect. So you can throw that in the Sharps container too if you want, because it will have blood on it. And then to dispose of the needle here, we will just twist the cap again and pull it off. And then this little gray piece that we pulled off earlier, if you stick the open round end onto the needle just so that it sticks on there, so that needle's covered up, and then if you just point it down and click this back lever forward, it'll shoot the needle off, and then you can just dispose of this in the Sharps container as well. And then you can just pull that lever back until it clicks, and then it's ready to go for next time. Do you have any questions? No. Okay, so this machine is capable to use a phone on your app. Are you wanting to do that at all?
I already have that all set up.
Okay, perfect. They did that for you last
Yeah.
time you were in? Okay, awesome. So, if you don't have any questions, would you mind showing me, you don't have to set it up or anything, but would you mind just telling me how you would use this at home?
Sure. I would open the lancing device with the words to me and stick the needle in there and take the cap off. Then put this back on and load it to make sure that it's ready. And then I would put the test strip in here with the gold side facing me. And then it'll turn on, and then I would put my finger and get my blood sample and then log it and dispose of my needle in the Sharps container.
Awesome, perfect. So if you end up having any questions or anything, just either come back into the pharmacy or give us a call and we'll help you out.
Okay,
All right, thanks for coming in today.
thank you.